Ladies and gentlemen, good morning and welcome to the Heart Failure Policy Summit. Before we begin, please allow me to extend my sincere apologies for not being able to join you live today. However, I am deeply committed to the cause we gather for today, and I am grateful for the opportunity to address you through this pre-recorded message. Here we are all aware of the enormous problem that heart failure and other cardiovascular diseases pose for our healthcare system in the 21st century. In Spain, heart failure is one of the most common chronic diseases, and its prevalence increases with age, with 17% of the population over the age of 75 affected. As we all know, our societies are aging, and therefore the number of people with heart failure in Spain will continue to rise as in other Western countries. Additionally, heart failure is a major cause of hospital admissions, further increasing the costs of the Spanish healthcare system. We are aware that the traditional risk factors of heart failure, such as diabetes or high blood pressure, do not explain all the burden of heart failure and other cardiovascular diseases in our societies. The degree of social inequality is one of the major drivers of heart failure and cardiovascular diseases. It is related to access to important resources for health promotion, such as income, housing, and the type of neighborhood where people live. Hence, addressing social inequalities within our societies is one of the most effective public health policies we can pursue. Not only the aging population and social inequality, but also other challenges we will face in the coming years, such as pollution and extreme temperatures due to climate change, are factors that will worsen the problem of heart failure and cardiovascular diseases in general. These three factors, aging of the population, social inequality, and, if left unchecked, worsening climate change, will create significant strain on our healthcare system, particularly concerning cardiovascular diseases. In the context of these challenges, it is an honor for the Ministry of Health of Spain to present at this Congress our National Cardiovascular Health Strategy. This strategy has been the first strategy in Europe after the COVID-19 pandemic, and it has clear and perfectly measurable objectives. I will not go into detail about its main measures, since our General Director of Public Health and Health Equity, Pedro Gullón, will address them during this same Congress, and I don't want to spoil his presentation. Therefore, from the Spanish experience, we wanted to encourage the rest of European countries to follow our example and develop national cardiovascular health strategies based on quantifiable objectives and the involvement of the medical community and patients' association. We, the Ministry of Health of Spain, will always be delighted to work with our colleagues and partners, collaborating wherever possible by sharing our experience and our most recent work in this regard. Finally, I would like to recognize the efforts and dedication of CardioAlianza, the Spanish Heart Failure Association, and the broader global heart failure community. Your tireless advocacy and efforts serve as catalysts for change, inspiring hope and driving momentum towards real outcomes. Also, I would like to express my support and esteem for the work of the Heart Failure Policy Network and the whole European Heart Failure Mission, and specifically for the organization of this summit. In conclusion, let us push our collective efforts toward we can forge together a path of political commitment with healthier population living in healthier societies. And we can all also commit to the development of more resilient and caring healthcare system in which heart failure and other cardiovascular diseases are top priorities. Thank you, and let the summit begin.